A groundbreaking study is set to investigate the effects of a ketogenic diet on mood stabilization in young people diagnosed with bipolar disorder. This initiative marks the first clinical trial of its kind, focusing on adolescents and young adults to determine whether a diet that shifts the body's metabolism toward fat as its primary energy source can complement traditional mood-stabilizing medications. With bipolar disorder often emerging in adolescence and early adulthood, the urgency to find effective, sustainable interventions remains high. Standard treatments rely on mood stabilizers, antipsychotic medications, and therapy, but many patients struggle with incomplete symptom relief, medication side effects, and long-term adherence. The upcoming study aims to assess whether dietary intervention can provide an additional tool for managing mood fluctuations, particularly in a population that faces unique physiological and psychological challenges. The trial, scheduled to span 16 weeks, will involve approximately 40 participants between the ages of 12 and 21. Each will follow a carefully structured ketogenic diet while continuing their prescribed medications, with researchers closely monitoring their mood stability, metabolic health, and overall adherence to the dietary protocol. Unlike traditional weight loss or metabolic studies, this investigation prioritizes psychiatric outcomes, seeking to understand how a shift in macronutrient intake influences brain function, mood regulation, and cognitive performance in individuals with bipolar disorder. Researchers have already observed encouraging results in adults who adopted a ketogenic diet, with preliminary studies suggesting improvements in mood, executive function, and energy levels. However, these findings have been limited to open-label studies without control groups, making it difficult to determine whether the benefits stem from the diet itself or other factors. This new study, with a structured design, aims to provide more definitive answers regarding the feasibility and effectiveness of the approach in younger individuals. The ketogenic diet is characterized by a significant reduction in carbohydrate intake, replacing it with healthy fats and moderate protein. By doing so, the body transitions into a state of ketosis, where it burns fat for energy rather than relying on glucose. This metabolic shift has been widely studied in the context of epilepsy, where the diet has been used for decades to reduce seizure frequency in patients resistant to medication. Given the similarities in neurological dysfunction seen in both epilepsy and bipolar disorder, researchers believe the diet may have potential as an adjunct therapy for mood stabilization. Throughout the 16-week trial, participants will receive medical supervision, psychiatric assessments, and dietitian support to ensure safety and adherence. Blood samples will be collected daily to measure metabolic markers, while psychiatric evaluations will take place monthly to track changes in mood symptoms, anxiety levels, and overall mental well-being. The study will also examine how the diet influences social functioning and quality of life, recognizing that the impact of dietary changes extends beyond biochemical markers. One of the primary challenges of the study lies in ensuring participants can maintain the strict dietary requirements. Adolescents and young adults often have less control over their food choices, especially in social settings or school environments. To address this, researchers will provide free ketogenic meals and nutritional guidance, reducing barriers to adherence. By evaluating how well young participants can stick to the diet, the study will help determine whether large-scale implementation is practical in real-world scenarios. Beyond individual adherence, the study aims to uncover potential mechanisms behind the diet's impact on mental health. One hypothesis centers around mitochondrial function, as bipolar disorder has been linked to mitochondrial dysfunction and impaired energy metabolism in the brain. By enhancing mitochondrial efficiency through ketosis, the diet may help stabilize neuronal activity and reduce mood swings. Another area of interest is inflammation, which has been increasingly recognized as a factor in mental health disorders. The ketogenic diet has demonstrated anti-inflammatory properties in other contexts, and researchers are eager to explore whether this contributes to its potential benefits for bipolar disorder. While the study focuses on mood stabilization, it also opens the door for further exploration into broader metabolic changes associated with bipolar disorder. Many individuals with the condition experience metabolic dysregulation, including insulin resistance, weight fluctuations, and increased risk of type 2 diabetes. The ketogenic diet, known for its ability to regulate blood sugar and improve insulin sensitivity, may offer additional advantages for individuals struggling with both psychiatric and metabolic concerns. If the trial proves successful in demonstrating feasibility and positive psychiatric outcomes, researchers plan to expand their efforts to larger, randomized controlled trials. A future study could compare the ketogenic diet with other dietary approaches, such as the Mediterranean diet, which has also been linked to cognitive and mood benefits. Such comparisons would provide valuable insight into whether ketogenic therapy offers unique advantages or whether multiple dietary interventions could serve as viable options for individuals with bipolar disorder. The study will be conducted across multiple sites, with leading research institutions collaborating to ensure rigorous data collection and analysis. The involvement of registered dietitians, psychiatrists, and psychologists will provide comprehensive oversight, ensuring the safety and well-being of participants throughout the trial. For many families navigating the complexities of bipolar disorder in young individuals, the possibility of a dietary approach offers hope for additional treatment options. While medications remain a cornerstone of management, the idea that nutrition could play a meaningful role in stabilizing mood symptoms is gaining increasing attention within the scientific community. This study represents a crucial step toward understanding the connection between diet and mental health, potentially paving the way for more personalized and holistic treatment strategies in the future. As research continues to uncover the links between metabolism and brain function, the ketogenic diet may emerge as a promising adjunct therapy, offering young individuals with bipolar disorder new possibilities for long-term mood stability and overall well-being. This groundbreaking study could change the way we approach bipolar disorder treatment in young people. If the ketogenic diet proves to be a safe and effective tool for mood stabilization, it may offer a new path alongside traditional medications. With growing research on the connection between metabolism and mental health, this trial could be a stepping stone toward more personalized and holistic treatment options. What do you think about using diet to support mental health? Let us know in the comments, and don't forget to like and subscribe for more updates on cutting-edge health research.